about IceWave. And when you're starting a demonstration, so let's talk about this from the context. It could be for yourself, or it could be that you want to apply patches to a loved one or in a business environment. What are some of the things that you do? Well, you can apply X39 behind the neck when you start off. Now, X39, when it elevates copper peptide, is going to help manage inflammation. It does a pretty respectable job at that. Eon, in my opinion, is a little bit stronger at reducing inflammation, and that's why X39 and Eon make such a great combination. But today, we'll talk about X39 and IceWave. So you could start off with X39 behind the neck or below the belly button. Placement doesn't matter so much. And we're going to apply a set of IceWave patches. So you first want to ask the person, before you ever apply the patches, what's their level of pain at? Get an assessment. Is it at a 5, a 9? What is it at? And you also want to find out, is it an acute or a chronic pain? That's actually quite a big difference. In other words, did they just get the pain in the last day, or is this something they've had for many, many years? Is it degenerative? That information can help with placements. You also, some of our members, they will give someone a drink of water before the demo. This is not necessary, and I'd only recommend doing this if someone doesn't respond. But what we found through practical experience and also through clinical research is that when people are not well hydrated, they may not respond as well to the patches. You need water to make energy, and you need water for detox, and you need water for tissue conductivity. And many people today, they just simply don't drink enough water. So those are some of the basics. Now, the clock method, this was developed by Dr. Stephen Haltuanger, a brilliant medical doctor, who I want to give all the credit towards with this. And so Dr. Haltuanger, what he found is that if you applied the tan patch to the point of pain, very often you could have people get pain relief just with that. But he found, after working with many, many people, that the pain is going to radiate through the tissues in like a specific direction, right? So it's where the injury is. Now, if we had that infrared camera, we could see where the damaged tissue was. We could see the pain, but this is much quicker and it's very effective. We're going to apply, once we apply the tan patch to the point of pain, we're going to apply a white patch above it. Only need to wait, let's say 10 or 15 seconds, and then ask the person, has there been any change in the level of pain? If there's not been any change, or let's say it goes from a 10 to an 8, then we would move it over to the 3 o'clock position. Wait 10 seconds, and then ask the person again, okay, is there any change? Let's say it went from an 8 to a 7. Oh, that's okay. Now we move it again down to 6 o'clock. So we're going around the clock. Now let's say it drops to a 2. Perfect. We could just leave the patch there and we're done. If it didn't change, then we're going to move the patch finally over to the 9 o'clock position, and we would select which point worked the best. Another thing that we can do is apply the patches parallel to one another. So in this example, since the pain was in the back, we could apply the patch to the sternum in the front of the body, or just right around the thymus area. A really good example of where this works well is on the knees. So when someone has knee pain, damaged knees, you apply the tan patch on the inside of the knee and then the white patch on the outside of the knee where they're parallel to one another. And that protocol works extremely well for knee pain. So before I go on, because there's other protocols here, Emily, did that make sense to you, or do you have any questions?
It did make sense to me, but there are a few questions that are popping in here in the chat. And so I think it'd be good for us to go over that. People are asking, what's the white patch? What's the tan patch? Maybe we start with the fact that there are two patches in this system and why.
Okay, so the white patch, all right, a simple way to describe this is that the tan patch produces a negative polarity in the body, and the white patch produces a positive polarity. So if we were to, in electrophysiology, if we were to look at the polarity in the body, we'd find that tissues can be oriented positive or negative. And as a general rule, the right side of the body is positive, the left is negative. The outside of the body is positive, the inside of the body is negative. So this is a guide, and in placing the patches, we want to work with the natural electrical polarity of the body. So in general, most of our patches are positive, but Energy Tan and IceWave Tan are two examples of negative. And benefit to this is that by inducing a negative polarity, it's soothing and calming. So for example, when women have their monthly period, I'm going to make some friends now. You apply the tan patch below the belly button to the area of the cramping, and you can find that just the tan patch is enough to reduce the cramping. You can, of course, still place an Eon patch, for example, on the back of the neck or X39, and that can help too. But the tan patch below the belly button is really good for cramping. But it's because this is soothing and sedating, whereas the white patch is more stimulating. So the idea here is that think of this like a battery, that once we apply the patches, we're getting a flow of energy. So if there's like between the patches, if there's damaged tissue, right? There's an injury there. Once we apply the patches, now we get a flow of bioelectrical energy. This starts to normalize the tissue, and we get drug-free pain reduction.
Now that totally makes sense. One question that I have heard before as well is if we're trying to utilize this clock method, which you really did describe so well, thank you. How do we unstick the stickers, right? How does that work? How would you suggest utilizing this method without having issue with it not coming off or not sticking?
Yeah, so that's a fantastic question. What we do in the demonstrations is we only use half of the adhesive. Now, the entire patch is being used, so there shouldn't be confusion about that. But we're only using half the adhesive. So I would recommend applying the tan patch with half of the adhesive, and the same thing with the white. Move it around. Some people like using medical tape. And then let's say we get it over here and the person says, oh, my pain is gone, right? Which is very common. Then you remove the other half of the adhesive and put the patches there permanently, right? For the day, anyway.
Perfect.
Yeah.
No, that really helps. I appreciate that. You know, I also know that sometimes when people first get a sleeve of IceWave or they get a sleeve of Energy Enhancer, they may think they only received one of the type of patches, either tan or white, but there's a little slip in the front part of the sleeve. So just make sure you open that all the way up so you can get both patches, because they do work best, right? You're saying when you use both, even if you can still have some relief with just the tan, right?
Yeah, yes, they are designed to be a system. So applying the tan patch, generally speaking, tan patch applied to the point of pain, and then moving the white patch around to the best location.
Perfect. I really appreciate you explaining this method, because I know that this while almost all of our patches are just so simple, just stick it on, right? And yes, placement can be helpful, but they work everywhere. I think for this particular patch, this is super helpful to understand exactly how to get the maximum benefit in pain relief.
Yeah, absolutely. And, this is just one protocol. There's many other protocols. For example, one easy way to use the patches is bracketing the pain. So people have lower back pain, upper back pain, and they don't want to use the clock method if it's inconvenient. They can just simply apply white on right, tan on left on the upper or lower back. And very often, over a period of time, they'll get very significant reduction in pain. So this is a very reliable protocol. Another protocol that works really well is to apply the patches on the bottom of the feet. Now, a little bit of an explanation here and some things to consider is that let's say that you're working with someone that has a chronic pain like Parkinson's disease, arthritis, MS. And we're talking about treating and reducing the pain, managing the pain, not treating the disease. These points in the body and the bottom of the feet, which are known in Eastern medicine to relax and sedate the body and also improve the overall flow of energy in the body. When you don't know what else to do, if for some reason the clock method isn't working or if it's confusing and you're not sure, a really great go-to protocol is applying the patches on the bottom of the feet. So if I was working with someone and I asked them in the beginning, how long have you had the pain? If they say, oh, I've had this for years, I would immediately go to the bottom of the feet if I knew it was a chronic pain. Because with chronic pain, the overall energy in the body is reduced and you want to build up that energy as best as you can. So applying the patches on the bottom of the feet for chronic pain is extremely effective.
So there are some questions here also about this awesome guide that you're showing us.
Okay.
Where can we find this, David? That's what they're all wanting to know.
Well, Emily, you'll notice down here that it says page 96 and back up over here, page 282. So this is a guide that we've had for a long time. It was put together by a number of amazing practitioners that we have, like Karen Kahn and Dennis Lobstein that are in our community. Love you guys. And we've given webinars over time on this, but the information in this manual is really intended for practitioners because it's fairly in-depth and complex. And so we don't have it in general circulation. But if it's something our members clamor for, we can see about having an abbreviated version. I believe we have a 30-page version of it, which is less cumbersome.
Well, I know we are working on some great new tools that'll be quick sheets with the most effective placement for all of our patches. And there are placement videos that are available on our YouTube channel, as well as placement recommendations for all of our products on our website. So maybe this full guide, like you said, is a little bit more than anyone needs, because no one needs to really be an expert on this fully, truly, right? It's simple for the most part, right? So it's good to keep it simple.
Keep it simple. And yeah, again, you're working with someone in pain. I know a medical doctor in Israel, and when he's working with patients that have Parkinson's, he just applies a set of IceWave patches on the bottom of the feet and a glutathione patch below the belly button, and it works every time, according to him, for reduction in pain. Another thing that's really powerful, and I've done this many times over the years, and forgive the, I think when we created these figures, they were a little bit more politically correct than maybe they are today. So please excuse them. But in any case, after you apply a set of IceWave on the bottom of the feet, and let's say you've got X39 on the back of the neck, if the person, again, they have pain throughout their entire body, applying the one set of IceWave on the lower torso underneath the feet, and then a second set on the upper torso is crazy effective. And you've got, while I would reliably use the bottom of the feet, there are a number of points on the upper torso that work extremely well. The elbow points, which are part of the heart meridian, are some of my favorite. And if we were to look at this from an Eastern medicine perspective, what we'd say is that stimulating the bottom of the feet stimulates the water element in the body. And then stimulating the elbows here stimulates the heart, which represents fire. So combining fire and water in the body is like one of the most powerful things you can do to move energy. And we know that the heart is basically, the electrical generator of the body, and the brain is, massive user of electrical energy. So this is all to say that stimulating the kidneys and stimulating the heart will produce tremendous energy flow in the body. And again, that's the whole idea. Raise energy production, raise energy flow, and this will dramatically reduce pain. Very reliable protocol.
I love it. I really appreciate you spending this time on these protocols. I know that we always do speak about keeping it simple, and I love that our products are simple, but I know there are some that just want to know just a little bit more. So thank you for sharing those specifics.
Yep, absolutely.